Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Today, we're going to talk about the injectable weight loss medications. So today we're going to talk about what these medications are, how you administer them, and the side effects and the things that you need to do to have the best outcome possible. So these medications mimic hormones that naturally form in your body. The first hormone that the medication mimics is GLP-1, and that stands for Glucagon-Like Peptide-1. And so this is a hormone that is produced in your body that reduces appetite. It slows down gastric emptying, which just means that it slows down the way that food moves down through your GI system. It also improves insulin sensitivity and controls glucose. The second hormone is GIP, which is the gastric inhibitory polypeptide. You don't have to remember these names, so we'll refer them to the GLP-1s or the GIPs. And I'll talk about the different medications that have a combination or one of these hormones. So the GIP hormone, or the gastric inhibitory polypeptide, it stimulates insulin secretion, so it increases the insulin in your body, which reduces glucose in your bloodstream. It decreases gastric acid secretion and also suppresses your appetite. So the combination of the GLP-1s and the GIP help to regulate your appetite. And so this is how essentially it works to lose weight. Previously, these medications have helped with patients with diabetes to essentially help with their glucose control. And what they did notice was that these patients were also having significant weight loss while using these medications. So that's how it kind of transitioned into the weight loss industry, because it does change and regulate the way that you feel about food and how your body reacts to food. I know this sounds really complicated, but the way that these medications essentially work is that it just slows down the speed at which your food goes down your GI system. And I'm sure you guys have heard to really eat slowly, because it does take time for your stomach to send a signal to your brain saying that it's full. So that's essentially how this medication works, is that it acts like the hormone that tells your brain that it's full. So these medications essentially keep the food in your stomach longer so that it has time to send the signal to the brain that you're full. So you essentially just eat less and you're just not as hungry with smaller amounts of food. Now, who are the candidates for the weight loss medication? So ideally for patients who are in the obesity category, which means that it's a BMI greater than 30, or if you have a BMI greater than 27, but you have another issue or comorbidity like hypertension or diabetes. These medications are administered usually by yourself on a weekly basis, and there is another medication that you do administer on a daily basis. Now, depending on the type of medication and the class of medications, the results do vary, and some are more effective than others. So first, I'm going to start with the GLP-1 agonist. So remember, same hormone that slows down gastric emptying and suppresses your appetite. First group of medications in the GLP-1 agonists are the semaglutides, and the brand names that you might have heard on TV is Ozempic or Wegovy. So these medications are essentially the same thing, but Ozempic was designed for patients with diabetes and Wegovy was designed for weight loss. So Wegovy was actually approved by the FDA in 2021 for this purpose. With these medications, patients are seeing an average about 15 to 18% weight loss in the span of a year. So next, we're going to talk about common side effects with these medications. So if you can imagine that the food is taking longer to digest down your system, those symptoms correlate with that, which is nausea, vomiting, bloating, diarrhea, and sometimes what people refer to as sulfur burps, which mean that you can actually burp up food that you might have had hours ago, which may not be fun for your friends and family members, but it is definitely common. Some other side effects are headache and fatigue. Now, more serious complications is the risk of pancreatitis, and also in some animal models, some thyroid tumors have been discovered. So always make sure to have a reliable provider that monitors you for these potential serious complications. So within the liraglutides, you have the brands Victoza, which is for the diabetic patients, and Saxenda for the weight loss patients. So the FDA approved Saxenda for weight loss in 2024. This is a daily injection. So yes, it kind of sucks a little bit more than the semaglutide. semaglutides. And on average, you're losing about 8 to 10% of your body fat in comparison to the 15 to 18% of the semaglutides. So the complications are very similar to the semaglutides, but the complications are a little less severe because the medication is less potent than the semaglutides. So next, I want to talk about the combination medications. So these have both GLP-1 and the GIP hormone receptor activation that I talked about initially. So these combination medications have actually enhanced weight loss and glucose control. So the first group of medications that have the dual agonists is the tirzepatides. Now, the brand names are Mounjaro for diabetic patients and Zepbound for weight loss patients. Now, Zepbound was approved by the FDA in 2023. These are weekly injections. In these patients, we are seeing 20 to 25% of weight loss in comparison to the 15 to 18% for the semaglutides and 8 to 10% in the liraglutides. And that 20 to 25% is comparable to bariatric patients, which is quite impressive. Now, these are weekly injections, the same common complications with the GI issues and the issues with the thyroid and pancreas. There are some new medications that are currently going through clinical trials right now and probably will be approved or at least enter the market in the very near future. So the first medication to look out for is retatrutide. Now, this is actually a triple agonist, which is the GLP-1, GIP, and glucagon. These initial trials, they're seeing greater than 24% weight loss in their patients. Another emerging medication is CagriSema, and it's a combination medication as well. And this is supposed to actually work together to increase your feeling of fullness. It's very important for you to have regular checkups with your provider to manage the dosing, titrate up, titrate down as needed, monitor for the common symptoms and the complications, and also keep an eye out for the very serious complications. Now, this is a big one. Patients who are on these medications, they do have a very high rebound rate once they get off the medications. What does that mean? That a large percentage of these patients, even up to 80%, are gaining all of the weight back after they come off the medications. Why? Because the medication is suppressing your appetite. You're not hungry. The minute you come off of the medications, you're hungry again. So they end up going back to their lifestyle and the same type of style of eating, so they end up gaining the weight back. So those 20% of people that are actually showing sustained weight loss, what are they doing differently? How are they doing it? It's because while they're on the medication, they are changing their lifestyle. They are enacting a schedule or a gym routine or an exercise routine that allows them to work on the exercise and the physical aspect of weight loss so that you can actually ramp up your own body's natural fat burning system so that eventually you won't have to rely on the medication. Another important thing to consider while you're on these medications is to make sure you're eating adequate protein. When people are consuming less food overall and less calories, they tend to eat less protein as well. But protein is very important for sustaining your muscle mass. Your muscle is natural fat burning organ. So when you increase your muscle mass, it will burn more fat and take the fat from the fat stores. But if you don't eat enough protein, then your body will take the muscles and use it for fuel. So what we are seeing is that a lot of patients, because of their decreased protein intake, they are losing a lot of muscle mass, thus in turn having less bone density. It is recommended to eat at least 1 gram of protein per pound of body weight. So what I mean by that is if you are 150 pounds, you should be eating at least 150 grams of protein per day to sustain the muscle mass in your body. So it's not just about eating less calories. You also have to be smart with the type of food that you're eating and really do focus on the protein, because that's what's going to help you sustain the weight loss after you come off the medication. Because ideally, you don't want to be on this medicine for the rest of your life. You want to change up your lifestyle to be able to have a healthier you without medications. The benefit of these medications are not only for weight loss, it can also help to reduce the comorbidities that are often associated with obesity, such as fatty liver, high blood pressure, high cholesterol, diabetes, insulin sensitivity, PCOS, and reduces the inflammation in your body. Patients that are not candidates for these medications are anyone who has a history of thyroid cancer in their family, or individuals with MEN2 syndrome in their family or in their personal history. So in some individuals, the medication can be covered by insurance, but it varies with the insurance plan and also may need prior authorization. Now, for patients who don't have insurance coverage, out-of-pocket costs can range from $500 to $1,000 a month. So it's not a very cheap option. We've had a very thorough discussion about these weight loss medications. I hope you guys understand and have a better idea of why we use them, who they're good for, and the things to look out for while you're on them. So if you like these educational videos, please follow and subscribe.